Hi, I'm Betsy Nicoletti. Thanks for joining me today to talk about risk as it relates to evaluation and management codes and roads not taken. So we all know this grid. This is the new and established patient office visit grid. We've got our 3 elements of medical decision-making, and 2 of 3 are required. I'm not going to talk today in this 5 or 6 minute video about using time, about a medically appropriate history and exam, or about the second element, data. Our focus today is going to be on the first and the third element, the number and complexity of problems addressed or condition risk, and the risk of complications and or morbidity or mortality of additional diagnostic testing or procedures or treatment. And the shorthand for that is management risk. And that shorthand comes straight from CPT. So this year, in the section about the first element, the number and complexity of problems addressed, they added this statement. The term risk, as used in the definition of this element, relates to the risk from the condition. And then they go on to say that while the risk from the condition and management risk may correlate, the risk from the condition is distinct from the risk of management. So when we're assessing a note, when we're deciding what the level of service is, we're going to separately assess the condition or problem addressed, the risk from that problem, from the risk related to additional diagnostic testing or procedures or treatment. CPT goes on to say, and this isn't new, that the risk of patient management applies to patient management decisions made by the reporting physician or qualified healthcare professional as part of the reported encounter. And of course, I've underlined those. CPT doesn't underline things. So the risk when we're evaluating an evaluation and management service relates to the practitioner, the reporting practitioner, and the encounter, the reported encounter. And we want to think about that in terms of hospitalized patients, for example. We may have one of the specialists who's seeing the patient at that encounter who is ordering a specific procedure or treatment option with moderate or high risk. We're going to credit the risk to the practitioner who assessed the condition and ordered the management, not to everybody who sees the patient that day. So if we're talking about the risk from diagnostic procedures or treatment, this risk from diagnostic procedure or treatment includes decisions made at the encounter associated with diagnostic procedures and treatments. This includes the possible management options selected and those considered with the patient and or family. For example, a decision about hospitalization includes consideration of alternate levels of care. And CPT gives 2 examples of this: a psychiatric patient with sufficient support in an outpatient setting, so they do not need to be hospitalized, and a patient with advanced dementia with an acute condition that warrants hospitalization, but who has a goal of palliative treatment. Risk also includes the medical decision-making related to the need to initiate or forego further testing, treatment, and or hospitalization. Initiate or forego. So we're not going to use a templated statement for every patient with osteoarthritis. We're not going to say we considered A, B, and C, but the patient decided on D, if it's the same statement for everyone. We're going to consider this initiate and forego because this is included in the risk when it's supported by details of the recommended management options, risks and benefits of those options, and the patient's decision-making regarding initiating or foregoing treatment. Maybe you have a patient who is being seen for depression, recurrent depression, and the physician says, listen, based on on your symptoms today and what you're telling me, I believe that you should be on an antidepressant, and I would recommend this one. And through shared decision-making, the patient says, no, they don't want to. They're forgoing that treatment. That includes the risk for that prescription drug management. So key takeaways. The risk of the condition is assessed separately from the risk of management. So the risk of the condition itself is assessed differently from the management of additional diagnostic procedures or treatment. Risk relates to the decisions made by the reporting practitioner at the reported encounter. I think that's really important, and we sometimes lose track of that. And risk does include consideration of alternate levels of care and decisions to initiate or forego treatment when clearly documented. So assessing risk, it's just one part of selecting the level of service when we're looking at an evaluation and management service. And although risk is only named in that third element, we are considering the risk of the condition when we're looking at that first element. If you're new to codingintel.com, we have more videos on the site that you can watch, and they're also on YouTube. And we also have articles that you can read. So thank you very much for joining me today. I hope this discussion of risks, roads not taken, has been helpful.